welcome back to the channel. I am Belitra and this is the Glorious Glow Up. So y'all, anybody who's new to the channel, welcome to the channel. Everybody who's returning, thank you for returning. So you guys, I just came to give you all a check-in. Today is day 3 post-op of my gastric sleeve. So I had VSG 3 days ago, which was Friday, February 16th. And I actually had it at the Northside Cherokee Hospital in Canton, Georgia. And if I didn't tell you guys before, my doctor is out of Peachtree Bariatrics and Surgical. I think it's Peachtree Surgical and Bariatrics, yeah, in Atlanta, Georgia. And my doctor was Dr. Shani Belgrave. So y'all, my surgery went absolutely perfect. Everything went well. The process was very, very smooth. On February 1st, I actually went to the hospital for my pre-op. They went over like all my health history. They actually did take a blood sample to take a look at my electrolytes for anesthesia. They explained the process. They explained what to expect when I come the day of surgery, where I would go. They were very, very thorough. And they actually have a bariatric unit just for bariatric patients. And they actually have a support group as well. And she gave me all the paperwork for the support group also before I left my pre-op appointment. So then I actually filmed some of that, so that'll be in a previous video before this one if you want to see that. So that same day I actually went to meet with my surgeon. I was weighed that day. That is when I started my high protein diet, which I guess it's kind of the same as the low carb diet, but I didn't have the 2-week liquid diet. My surgeon did high protein for 2 weeks basically, and then the last 2 days I fasted and I just did only liquids. So that wasn't bad at all. They actually gave you a list of things that you could have and put together for those days. So that was really smooth. I actually didn't find myself, well, only a few days I found myself hungry because of skipping meals, because I felt like when I was eating protein or more when I eat more protein, I feel more full and more satisfied, and then I feel like I don't need anything to eat later, and then I noticed later on I'm hungry. So I just ran into that a couple times where I was hungry, but I never had a need or felt the need to cheat on my diet. So everything went really, really well. Like everything was pretty smooth. That during that time I did have coffee. I'm a Lyft driver, and they do say that you can have unsweetened coffee. So what I would do is in the morning I would get either just some espresso, iced espresso from Starbucks, and then add my protein shake that was supposed to be breakfast to my coffee, so I could have my coffee still. Or I would just take some coffee, and instead of using milk I would put the protein shake in. So that's how I did that. And then I snacked on nuts like cashews, and then I had like a mixed nut medley that came from Dollar Tree with like peanuts, pistachios, and walnuts or something like that. I finished that high protein diet 2 days before my surgery, and then I did liquids, which I did Powerade, water, broth. It was the Powerade Zero. Of course, everything is sugar free. I did a little bit of Jello those days, and everything was pretty smooth. And then the morning of surgery, my sister took me. We checked in. I literally didn't have to wait that long. My check-in was for 8:30 in the morning. So we checked in. We took some footage of the hospital because it was super beautiful and clean. Very nice hospital. And then we weren't there long at all. And they had my sister just sit in the waiting room. And then they took me back to my pre-op room and started to prepare me for surgery. So they give you these wipes, and I had to wipe down with the wipes, which I did the night before, because during your pre-op appointment they give them to you, and they tell you to take a shower with antibacterial soap and then dry off and then apply the wipes to your whole body. So I did that, and then as soon as we got into pre-op, we did it again. So from there I went ahead and changed into my hospital gown. They gave me a bag for my personal items to put in, which I had already brought a backpack with full of stuff that I didn't even use, but I just wanted to be sure, you know, I had everything that I needed. So after that, anesthesia came in to speak to me. They sent my sister in. She just sat with me probably not even an hour. Then my doctor, my surgeon came in. My nurse was in there. Like, everybody was just come in, just let me know what to expect, that we were gonna get going soon. And so I actually went into surgery like just before 11 a.m. and it was so quick. The only thing that was like a little, I guess, a little rough was them being able to find veins to put an IV. They had sent in like 3 different people, and my hand is pretty sore from the IV. So I ended up having one in my hand and one in my arm here. I guess in case one of them wasn't working, they would use the other one, but they actually used both of them the whole time. So they still needed to draw more blood, so they actually drew blood from this hand too. So I just had like IV ports everywhere. But going into surgery, I wasn't nervous at all. Like, it's so weird because like after maybe a few days after my pre-op appointment, I was like, I don't really need to do surgery. I'm just gonna tell them to cancel it. I guess just because of being nervous. I've never had surgery before. And then I don't know, I just continued to like pray about it, and I've had peace about this for years. Like, I've been praying about this for years. I've been like looking and searching for doctors for years. So it wasn't like an overnight thing. So literally, like, I had all the peace. Like, I wasn't nervous at all, not even a little bit. So I just was ready to go. They were like, you ready? I'm like, yeah, sure, let's do it. So I don't even remember much of anything in the operating room. I remember them rolling me out. My sister was taking videos for YouTube, and we got to the operating room, which was not far from my actual room. And then they just asked me to scoot over from the hospital bed that I was on. They of course made it higher so that it was level to the other operating table, and they just told me to scoot over and get on the operating table. I remember that. But y'all, I don't even remember laying down, to be honest. I don't remember laying down. I remember somebody saying cocktails, and that was it. That was all. So that's all I remember. I don't remember laying back. I don't remember laying down. I don't remember anything else. That's all I remember. And I just remember waking up coughing, and it hurt. And I was just like coughing up cold, and I was like, ouch, that hurt. And so there was a man next to me. I don't know what he was doing. I guess he was my recovery nurse. So as soon as I woke up, I remember like waking up coughing, saying ouch, and then I remember falling back to sleep real quick. And then I woke up again, and I was saying something, and he just immediately rolled me out of the recovery area into my room. And so he took me to my actual hospital room, because I had to stay for one night, just depending on like how well I was progressing. So he took me to my hospital room. As soon as we got there, I had to pee so bad. So I was like, I have to pee. So I went ahead and got up with the nurse's help. Got from the bed, went to pee, and got back in the bed. I really didn't feel too bad. I was hurting, but it wasn't like excruciating pain. So I'm guessing that was probably like the gas pain that I was feeling, but it wasn't really bad at all. It wasn't very bad. But I know coughing was very bad. Coughing was painful. It does feel like you had like the craziest abdominal workout ever, and it's really hard to like move certain ways because of the soreness. But other than that, I felt fine. I probably slept a few hours because I was still really tired and groggy from the anesthesia. So I didn't do any vlogging. I don't know if my sister recorded anything. If she does, I will upload it so y'all can see. But I slept a lot that day. I just remember sleeping and waking up having to pee a million times because they had the IVs going. So I just remember having to pee all day long. So I did drink. They had these little 1 ounce cups for me to drink. As soon as I started to drink, everything went down perfectly. I didn't throw up at all. I didn't feel nauseous at all. And I think probably because my surgeon, she had this little patch that you put behind your ear. Oh shoot, I still have one behind my ear. I need to take it off. But you're supposed to, ouch. This little patch here, you put it on. You put this behind your ear and it stays there for 3 days. So today is the 3rd day I take it off. I did that before surgery, the morning of surgery. You put that on. And then there is also a pill that she had me take before surgery. And that was the only thing I had that day. So I couldn't drink any liquids except for a little sip to take the pill. And the pill was for nausea as well. So I didn't have any nausea. I didn't have any vomiting. I didn't have any complications whatsoever. Everything went really smooth. And so after a few hours, I was actually able to get up and I walked around in the halls. I was able to get up and go to the bathroom by myself, which they didn't really want me to, but the thing is, I wanted to get to a place of being comfortable where if nobody was able to assist me, I would still be able to go to the bathroom and bathe myself and stuff like that. So I definitely went ahead and took the initiative to walk by myself with the little IV pole, walked around, went to the bathroom. I just needed them to unplug me from all the machines and stuff. And I actually felt good. Like, I didn't have that much gas pain until probably now I'm feeling it. But it's still not horrible because I think it's because that I already dealt with a lot of gas just in everyday life because I have like mild gastritis. So it kind of feels the same as that. And so the only way you can get that out is by walking. That's the only way that I found that helped me is when I go to the gym or go outside and walk a lot and it comes out. So I did buy Gas X, but I did not end up using it because that's like a whole nother type of gas. And they wanted me to have chewable Gas X, which I don't have. I bought the capsule, like the little small capsules. So I didn't use it. I'm just probably going to do some more walking. And I haven't been outside to walk yet because it's been freezing, like 30 degrees. And I don't even have anything like warm to put on that won't hurt my stomach at this point. So yeah, I just walked around in the hospital. I've been walking around here in the house. I've been having broth. I've been having a little Jello, but it's like, it's nasty. The Powerade Zero that I bought is nasty. I noticed that the popsicles that I bought taste nasty. They were good before. I have these protein waters. They're terrible. I don't know. But I'm not in a whole lot of pain, y'all. My surgeon did prescribe oxycodone for whenever I do need it. But I try to not take it until like nighttime so I can actually like rest. But I've still been using my spirometer, which is the little breathing thing. I'm not gonna get up and get it because it's kind of painful. But you have to breathe in it every, I think it says 4 hours. You have to breathe in it, try to get your lung capacity back up to before surgery. Oh y'all, but the one thing I did wake up with was a sore throat and what seemed like pneumonia. Like I was coughing up cold and I'm like, I did not have a cold before I had surgery. Like, why is it like this? So my whole back of my throat was swollen. My tonsils were swollen. The little hangy ball thing in the middle of your mouth, it was swollen. My throat was sore. I was coughing up cold and it hurt my stomach. So I was holding my stomach whenever I coughed so that it wouldn't just feel like my insides rattling around, because that's what it feels like, real loose. So yeah, I would just hold my stomach. But the last day at the hospital, they gave me this abdominal binder. Okay, I'm gonna try to show y'all. This is the abdominal binder that they gave me. It's not tight. It's not tight. It just wraps around to be supportive for your core. And it does help me so that I don't have to always use a pillow to hold my midsection when I have to get up. So yeah, I feel like all of the cold is out now. My incisions, some of them hurt, some of them don't. I ended up having 5 incisions. There is like one right under my breast, one underneath that, one more to the left, one in my belly button, and then one on the right. So the one on the right is the one that hurts probably the most, and my navel, the one that's inside of my belly button, hurts too. So my stomach is still a little swollen. I was actually using a heating pad from the day that I came home on like a warm setting, and then I switched over to ice pack. So last night I slept with an ice pack on my stomach, and I feel like it made it like much better because I feel like some of the swelling went down. So I think I'm going to continue with that, with the icing, because I feel like my soreness is a little bit better. So at the moment, I'm still burping a lot, so I have to stop and burp. But I don't feel any pain like in my stomach where they actually cut my stomach. I don't feel any pain inside. The only pain that I have is kind of mild, and that's from my incisions and from the gas. But I don't actually feel any pain otherwise. And like I said, I've been keeping everything down. I haven't thrown up. Nothing's really made me sick on the stomach yet. I'm just drinking fluids right now. They gave me a good amount of medication for nausea, but I don't need it, so I'm not taking it. They gave me a pill to coat my stomach before I eat, so I will take that. I do take that, I guess before I have broth or something like that. And I think that's all, you guys. I don't know. I ordered this, I ordered some 2-ounce little condiment cup things. I can probably show y'all those. Okay, so I ordered these so that I can measure out how much I'm drinking, and they gave me a checklist so that I could check off when I've drank 1 ounce. So when I do one of these, it's 2 of them checked off already. So yesterday I was not able to get 64 ounces, not even close. I got probably about halfway yesterday, and then today I'm gonna try my best to get more. But that is all I got in yesterday. So I am going to mention this pillow, you guys, because this thing has been so helpful. I'm glad. Before I had my surgery, I went to other people's pages that had VSG and just looked at items that they said was absolutely helpful for them on this journey and the healing journey and the recovery. So somebody did mention to get a wedge pillow. I'm going to show y'all real quick. I got this huge wedge pillow that I use. It's really soft, but you have the option of getting a firm one and it's just the wedge pillow, or you can get this one, which it has the neck pillow and the wedge pillow. So this you can take on and off, use it if you want or don't use it. So I got the one with both just to be able to support my neck. Because one, I'm not a back sleeper. I don't sleep on my back. I usually sleep on my stomach. So I've been kind of uncomfortable since surgery, but I'm kind of getting used to sleeping on my back now because I don't want to lay on my incisions. So that pillow has helped a lot with trying to get up, because laying flat on the bed and trying to get up with this stomach muscle soreness and the incisions, it's not gonna be fun. So but I think that is all, you guys. If you all want to know where I got the pillow from, I will link it down below. It actually came from Temu, believe it or not. It was $31. Trying to think if I got anything else from there that was helpful or that is being used that's helpful now. Oh, let me mention another thing, y'all. I forgot to tell you guys. My surgeon actually prescribed blood thinners for the next, I think, 2 months. Either 2 months or 4 months. I want to say 2 months. I'm not sure. But I have to have the injections into my skin, either any fatty area. You can put the injection, but it's a blood thinner to prevent blood clots. And so I have to do that twice a day. And it's actually not bad. I thought it was going to be bad. I thought it was going to be this big, huge needle I was going to have to jab myself with, but it's not. It comes already filled with the medication, and you just literally click it. You'll feel like a little stick, and the medicine will go in, and you're good to go. So I think that's all for this video, you guys. I just wanted to update you all real quick. I literally been like sleeping, walking, drinking, going to the bathroom, doing it again. So I'm just here resting, walking when I can, trying to, keep from just sleeping all day. But I am definitely taking it easy so that my body can heal. And then next week I will be on the full liquids, which will be protein shakes and things like that next week. So that is all for now, you guys. Leave me a comment down below if you have any questions. Thank you for watching this video. Until next time, I'll see y'all later. Bye.